Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be doing my medication administration, my oral medication administration video. I'm going to start by by verifying the provider's order, and then I'm going to verify the 6 rights of medication, which are, I'm going to make sure I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I am going to pull up my patient's MAR, and I'm going to verify the medication against the provider's order, and I'm going to do any drug calculation. If I need to do any form of dosage calculation, I'll do that. So today the doctor has ordered 100 milligram of Colace PO, and that's 1 tablet. 5 milligram of Coumadin PO, 1 tablet, and 20 milligram of Lasix PO, that's also 1 tablet, and 20 milligram equivalent of potassium chloride, and that's also 1 tablet. And he has also ordered 500 milligram in 15 ml of acetaminophen, and that's a liquid suspension. All right, so I am gonna take all my supplies. I'm gonna enter my patient's room. I'm gonna close the door behind me for privacy. I'm gonna introduce myself to my patient. I'm gonna have my patient identify himself using 2 identifiers. Knock, knock, knock. Hello, sir. My name is Terry, and today I'll be your nurse. Can you confirm your name and date of birth? I'm gonna verify with the wristband. Okay. All right. So Mr. Mills has correctly identified himself, name and date of birth, using 2 identifiers. All right, I'm gonna perform hand hygiene. Okay, Mr. Mills, before I start, can you tell me if you have any form of allergies, maybe to any medication, any food, or any environmental allergies? No? Okay, so today your doctor has ordered a couple of medications, but I'll go over those with you in a few minutes, okay? All right, so I'm gonna perform hand hygiene, and then I'm gonna apply my gloves. Okay, so now I am gonna pull up my patient's chart in the room, and this is gonna be for my 3rd verification of the medication, and then I'm gonna verify the orders in the MAR, and because I'm giving warfarin, I'm going to check to see that Mr. Mills' INR is within an acceptable range for that medication, and as well as I'm giving acetaminophen, so I have to verify that I have a current pain scale of 0 to 10, as well as I have to check the temperature and to get a full set of vitals to ensure that everything is okay for me to administer those medication, okay? All right, so Mr. Mills, for these medication, do you want me to put them all in 1 cup, or you want to take them individually? Okay, so I'll put them in 1 cup for you. All right, so I am gonna start with my Colace, and Colace, it's a laxative, and it softens the stool and prevents constipation. Some of the side effects of Colace are nausea, vomiting, diarrhea, or some people may get a bitterness in the mouth. Some adverse side effect though that you might experience are abdominal cramps or rash. So let me know if you experience any of those symptoms, okay? Any questions on the Colace? No? right, Mr. Mills. So next I have your warfarin or Coumadin. This is an anticoagulant or a blood thinner, and it is used to treat or prevent blood clots. Some of the side effects of Coumadin might be bleeding. You may bruise easily, or you may experience joints or muscle pain. Some of the more concerning side effects, however, are going to be bright red stools or dark tarry stools, as well as you may experience dizziness upon standing. I need you to let me know, like right away, if you experience any of these symptoms. Any questions for the Coumadin? No? Okay, so our third medication is going to be our Lasix, Mr. Mills, or furosemide, and this is a loop diuretic. Some people call it a water pill, and what this does, it helps with edema or swelling, and some people might get it helps with edema or swelling that some people that have congestive heart failure might experience, or for persons who have kidney or liver disease. Okay, some of the side effects of Lasix are urinary frequency, and this is because the body is going to be expelling the fluid rapidly. You may experience constipation, or some people may have blurred vision. Some of the more concerning side effects, however, are going to be chest pain, shortness of breath, muscle cramps or weakness. I need you to tell me if you experience any of these side effects, okay? Any questions on the Lasix before I go? No? Okay. Okay, our final tablet, Mr. Mills, is going to be your potassium chloride, and this is 20 milliliter equivalent, and it is an electrolyte, and we often give Lasix. We often give potassium chloride with Lasix, and this is to prevent a low potassium level. Some of the side effects that you may experience with the potassium chloride are nausea, vomiting, diarrhea, or upset stomach. Some more concerning side effects, however, are going to be irregular heartbeat. You may experience tingling or severe muscle pain, but as usual, any of these symptoms you have, you let me know right away, okay? Any questions for the potassium chloride? No? All right. So our final medication that I'm going to be giving you is your acetaminophen or Tylenol, and this is a fever reducer or pain reliever. So what it does, it treats fever, or it helps to reduce pain. Some side effects that you may experience is nausea, vomiting, constipation, but more concerning side effects, however, would be dark or decreased urine. You may have any abnormal swelling or yellowing of the skin or eyes. Let me know right away, since these are some of the concerning side effects. So this is a 500 milligram, and it's in 15 ml. Your doctor has ordered the whole 500 milligram. So I'm gonna administer the acetaminophen, and in order to administer, I am going to ensure that there's no sediment. There's no sediment in the bottom, and I'm gonna hold the label as I pour, I have to ensure that I'm holding the label, and I have to measure on a flat surface, okay? So I'm holding the label. I'm gonna uncap my bottle. I'm gonna place the cap upward, and then I'm gonna measure my 15 milliliter on a flat surface. Okay, so before I recap my bottle, I'm gonna clean the lip and the neck just to make sure there's no drop, and then I'm gonna recap. Okay, so I'll show it to the camera. That's 15 milliliter. Okay, all right, Mr. Mills, I'm gonna put you in a sitting position. That way it's easier for you to take the pills, okay? Do you want to have some water or some juice so you could help to swallow the pills? Okay. And then I have your Tylenol. You could take the Tylenol. Do you want to have some juice or some water to help to get that down? Okay. All right. So now that the pills, the medication have been administered, I could just verify one last time with the wrappers to verify that it's the right medication for the 4th time. All right, so I am gonna discard my trash. I'm gonna discard my gloves, and I am gonna perform hand hygiene. All right, Mr. Mills, how are you feeling? All right, so I'm gonna ensure that I lower the bed. I'm gonna ensure that the rails are down, and I'm gonna ensure that the call bell is within reach before I go. Do you have any questions for me, Mr. Mills? No? All right, so I am gonna go document my procedure, and then I'll check back on you in a few minutes, okay?